Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
Hello.
Hi, good evening, everyone. Good evening, sir. So, I'm Dr. Srishna, and we are delighted to have you all join us today for today's webinar, organized by Drools in collaboration with Indian Association of Veterinary Dermatology. Thank you all for taking the time to attend this session. And to begin, we have Dr. Nagarajan to deliver the welcome address and set the stage for today's session. Over to Dr. Nagarajan.
Hello, good evening to everyone. On behalf of Indian Association for Veterinary Dermatology and our knowledge partner Drools, I welcome all of you for this wonderful webinar. Actually, we have got a lot of confusion by seeing the lesions. So we have got starting from primary lesion to secondary lesions mixed together, and it has been presented in a different way. And we'll be confusing what to take, what is the way to diagnose and other thing. So we thought we can go for a title in such a way that lesion to diagnosis. So that is done by our great speaker, Dr. Anisha Tiwari, who is here with us. And so I welcome all of you and also the speaker. And I welcome you for our Indian Congress for Veterinary Dermatology, which is going to happen in 4th to 6th June 2026 at ITC Royal Bengal. I welcome all of you, and even pre-Congress workshop is going to happen more on arthroscopy and dermoscopy and like instrumentation. So like we have got other thing like even the cryosurgery like that. We are planning to do that. So please come over there and enjoy yourself and have a derm feeling in a great way. So we are going to have all the three top star in the dermatology. So they are going to give they are going to deliver lectures. 16 lectures we are going to have, and you know very well about the program and other thing I have already circulated. So please, all of you come over there and enjoy the program. And I request our Drools team to introduce our speaker. Thank you.
Thank you, Dr. Nagarajan. So before we start, I would like to request everyone to please fill out the form in the comments box to receive your certificates for today's webinar. Link is there given in the comments box. And now it's time to introduce our esteemed speaker, Dr. Anisha Tiwari. Dr. Anisha Tiwari is a renowned small animal veterinarian from Jammu and Kashmir and founder of India's first exclusive small animal dermatology clinic. A gold medalist, she earned her VVSc and AH from JNKVV and MVSc in parasitology from Gadwasu, Ludhiana. followed by advanced training in veterinary dermatology across South Korea, USA, and France. She is internationally recognized for her work in dermatology and recipient of the prestigious Peter Irke Scholarship 2026 by WAVD, and she has presented her research at leading international forums including WCVD, ESVD, ECVD, AMAMS, and VESPA. Her key areas of interest include uncommon fungal diseases, antifungal resistance, and CO2 laser applications in veterinary dermatology. And with this now, I hand it over to Dr. Anisha Tiwari for her expert session on pet dermatology. Over to Dr. Anisha.
Yeah, hello everyone. Can you hear me clearly?
Yes, doctor.
Yeah.
Audible.
First of all, I would like to say a big thanks to Drools and IAVD for inviting me here. And I am truly delighted to be a part of this program. So, without further ado, I would like to focus more on structured clinic approach to veterinary dermatology so that step by step we can follow in our clinical practice how to approach this dermatological cases. Okay. So, my first slide is about 5 steps dermatology formula. As we all know, in veterinary dermatology, our eyes and ears plays a very important role and one of the most important diagnostic tools in our dermatological practice rather than any other expensive machine. Because in veterinary dermatology, what we see and what we hear from the clinical history or from the client, it will provide us 70 to 80% diagnosis even without touching animal. Correct. So, in veterinary dermatology, when we use our eyes, it is all about to recognize pattern. So, we should train our eyes so the skin will give us the diagnosis. And secondly, role of ear. Our ear is as important as our eyes because dermatology is history driven. So whatever we hear history from the client, for example, we ask client like first question, is it pruritic or not? So is it itchy or not? So the client say, yes, my dog is quite itchy. So that on the very same day, we can differentiate. There are few dermatological problem which causes itching in dogs, correct? Then on the basis of our eyes and ears, we narrow down our differential list on the basis of pattern recognition, on the basis of medical history, on the basis of like response to the treatment, other environmental condition involvement is there, seasonality is there. So on the basis of few questions, we can narrow down the differential list. Okay. So before jumping into the diagnostic test, we should use our eye and ear as a powerful tool. Then these are the various emotions of our client we face every day in our clinical practice. And sometimes we see like frustration, anger, confusion, expectation from the client, especially those client which have having a like chronic skin problem, their pet suffering from the chronic skin problem, long standing cases, and we are not able to diagnose their cases on time, and sometimes reoccurrence are there. So these are the various emotions of our client, and basically the problem is not related to the disease. Sometimes it is related to the lack of a structured approach towards the dermatological cases. So that's why we are here today to understand how to approach those skin cases like in a proper way. So, communication. In dermatology, communication is as important as medication, correct? Because in communication, during consultation, what we do, we sometimes overpromise the client. So, avoid overpromising the client. We need to educate the client about some allergic condition. For example, canine atopic dermatitis. This disease takes time, and also, we need to tell the client about the reoccurrence of the diseases and also about the long term management of some diseases. So, this will help in solving various dermatological problems in our practice. So, to diagnose dermatology cases, we don't need more tests, we need better questions. The first most important question we ask from the client whether the disease is pruritic or not. Okay, if the client says yes, it is itchy, then we can say maybe it can be infectious, parasitic, or allergic. And the second question is also very important. Where is the itching? Because there are few distribution. If the client says that the itching is on the lumbosacral area, then we can what comes to your mind first? Then the flea allergy dermatitis is the top differential. If the client says the itching is in the ear pinna or margin of the ear or in the elbow, then we can at least make narrow down the differential list, and we can suspect yes, it can be sarcoptes or notoitrus. Okay, when the client says that there is a itching on the paws or groin area or on the face, then we can make a differential like it can be atopy. So it is not the like confirmed diagnosis, but we can narrow down the differential list, correct? Then the second important question is about the environment. We should ask about the environmental condition, because sometimes the disease is not into the skin of the animal, but it is in the environment. And also the important question is, are other animals are affected or peoples are affected in your house? If the client says yes, my other cat or some other person is involved and there's a lesions on their body too, then we can like assume that there are some zoonotic kind of condition, for example dermatophytosis or sarcoptes, it can transmit to the people also. Then the third important question sometimes we miss in our communication or consultation, like the history treatment, like what has already been used. If you are using any kind of medication, then ask about the response to the treatment, whether there is a partial response to the treatment or do the lesions worsen with the treatment, because there are few skin problem or skin conditions which resembles with the allergy. For example, in case of the cat, if the cat is suffering from feline herpes virus, and if you give a steroid, it will worsen the condition. So that's why this part of like response to the treatment we need to ask from the client in our consultation room. Then before diagnostic test, these four things are very important in veterinary dermatology: a good medical history about age, breed, sex, and color. Why? Because there are few again dermatological problem which are age related. On the basis of just age, we can narrow down the differential list. For example, in younger age or young pet, what we see the congenital problem most commonly, parasitic, follicular dysplasia, for example, color dilution alopecia and black follicular dysplasia, and atopic dermatitis also from 6 months to 3 years of age or middle age patient, we can see the atopic dermatitis. But in contrast, in older patient or older age animal, what we see neoplasia. In case of the cat, feline paraneoplastic syndrome, and then metabolic disorder, hormonal problem, and hepatocutaneous syndrome. So these are the problem we see very commonly in older patients. Now there is one example of cat here. What you can see, there's a alopecia, but I am giving you one clue over here, like it's a old patient, and here you can see the non-pruritic ventral alopecia, and the most important clue is there's a shiny smooth appearance of the abdomen. So whenever you see the older cat, and when the client says it's non-pruritic, non-itchy, and when you see the ventral alopecia, especially the shiny or smooth appearance of the lesion, then immediately this is the classical example of paraneoplastic alopecia. So don't, without wasting your time, just jump into the further modality. For example, send the animal for ultrasound, because this paraneoplastic alopecia is all related to internal malignancy. So this is another example of paraneoplastic alopecia, where you can see the whole body, there is a alopecia, and hair is easily appellated from the skin. Okay, so this is paraneoplastic alopecia. Whenever you see these kind of condition in older cat, shiny glistening appearance of the skin, it is always associated with the internal malignancy, and think of cancer. And it is commonly associated with the pancreatic carcinoma. Okay, so the systemic sign you will see along with the carcinoma, there's a lethargy, inappetence, weight loss, and sometime liver metastasis. So this is the condition you will see in case of the older cat. But for the confirmation, what we do, we send the sample for the histopathology. On histopathology, you will see the follicular atrophy with miniaturization and epidermal hyperplasia. And the solution of this condition is just the tumor removal. Then there's a symptomatic relief until reoccurrence and metastasis. So this is the way we can detect, diagnose, and treat the condition, although the prognosis is quite poor in case of paraneoplastic alopecia in older cats. So this is the second example. Again, this is the German Shepherd, 9-year-old. And here you can see the crusting hyperkeratosis of the paw pad. So what do you think? What it can be? This is just the dermatological cases or something else going on in this condition? Basically, whenever you see crusting or hyperkeratosis of paw pad, always think, even in older patient, always think of something bad going on, like inside some neoplasia conditions going on. So without wasting your time, again, do the ultrasound in this patient. Because this was the case of superficial necrolytic dermatitis, which is also known as hepatocutaneous syndrome. And whenever you see the older dog, cracked pad, liver problem, so we call it hepatocutaneous syndrome. And the classical histopathological finding is French flag appearance, where you can see the red, white, and blue, where red indicate the parakeratosis, white indicate the laminar edema, and blue appearance here is the blue line is basal cell hyperplasia. So we call it French flag appearance in case of hepatocutaneous syndrome. And sometimes you will see the hyperkeratosis or around the periocular area or muzzle, around the muzzle. And this is related to concurrent hypoaminocidemia, concurrent diabetes mellitus, glucognoma, and sometimes it is due to the phenobarbital drugs and hepatopathies. They are most commonly hepatopathies there, but sometimes I can see the pancreas involvement or pancreas carcinoma or glucognoma is there related to hepatocutaneous syndrome or superficial necrolytic dermatitis. On superficial necrolytic dermatitis on ultrasound, you will see the honeycomb appearance on ultrasound. And when honeycomb appearance is absent, then you have to find out something bad going on in pancreas or pancreatic mass is there. So we need to do the ultrasound for this condition again. So dermatology is not only about the microscopy. Sometimes we need other modalities to find out like internal malignancy. Okay, then age, we have detect neoplasia along with the dermatological lesions. But if we talk about the breed, there are few breeds where we can see the breed predisposed problem, skin problem. For example, in case of the Akita, when you see the crusting and pustules, generalized pustule all over the body, so always think of pemphigus foliaceus because it is quite common in Akita. And sebaceous adenitis is the second most common problem in case of the Akita. Uveo dermatological syndrome is also common in case of the Akita. So this is the tabular form I have made for you. So this is the few conditions which is quite common in particular breeds. Like for example, if we talk about boxer, you will see canine flank alopecia, which is quite common. In case of golden retriever, which is the common breed in India, acrylic dermatitis, you see, I think, like daily in your clinical practice. Pyotraumatic folliculitis and hypothyroidism is common in golden retriever. If we talk about English bulldog, atopic dermatitis, canine flank alopecia, facial folds and tail fold intertrigo. And poodle is quite emerging breed in India. There are so many poodle nowadays in India. And we see mostly in poodle sebaceous adenitis and follicular dysplasia sometime. And in case of the Dachshund, color dilution alopecia and sterile nodular paniculitis. Here again, I am giving you one example. Like this is for which breed? This is Siberian Husky. And here you can see the periocular crusting. Okay, so what do you think? It's a young Siberian Husky. So again, when you see Husky and when there is a periocular crusting, always think of what? Zinc responsive dermatosis. So always try to rule out zinc responsive dermatosis whenever you see the Siberian young Husky with crusting periocular. So this is again some other examples of zinc responsive dermatosis in case of the Husky breed. And on dermatopathology, what you will see, like whenever there is a case of zinc responsive dermatosis, on the basis of breed, first of all, we can detect or like assume or suspect it's a zinc responsive dermatosis. But for confirmation, we need to send the sample. Then you can see the parakeratosis, hyperkeratosis on dermatopathology. And also there is a hypogranulosis, or there is no stratum granulosum layer in case of zinc responsive dermatosis. So again, this is the crusting on the husky and periocular and perioral. So this is the example of zinc responsive dermatosis. Again, there are beautiful pictures of zinc responsive dermatosis given by Dr. Candace Souza. And then there are two types of zinc responsive dermatosis. Syndrome 1, which is most commonly we see in Siberian Husky, Alaskan Malamutes, and other breeds, which is due to the genetic defect in GI absorption of the zinc. While in case of syndrome 2, growing puppies diet deficient in zinc with or without excess phytates or mineral calcium, which is related to the calcium or diet deficiency. Okay. But in case of the husky, we see most commonly because of the breed predisposing problem or type 1. Okay, so by zinc supplementation, especially we give like 2 to 4 mg per kg elemental zinc daily, and we can cure this condition by giving zinc sulfate or zinc gluconate. This is again the third example. Which breed is this? This is a Pomeranian. And whenever we see the truncal alopecia, along with truncal alopecia, we can see very clearly the hyperpigmentation. So what do you think what it is? So this is alopecia in Pomeranian, which is what is the common disease in Pomeranian? What is your differential? Yes, this is the alopecia X, which is very, very common in Pomeranian, which is related to non-pruritic symmetrical alopecia, along with hyperpigmentation, but is sparing the head and limbs. Highly, highly suggestive of alopecia X. And this is the dermatopathology of alopecia X. What happened in this? Basically, you will find lot of telogen hair. There is not any kind of anagen, and also one peculiar presentation of alopecia X is that there is a trichilomization, or here you can see the red color. No, this is the proper presentation of alopecia X dermatopathology slides. And here, this is, you can see the telogen hairs. There is no proper differentiation of hair follicle like infundibulum, isthmus, or bulb, and without any kind of hair shaft. Then why I'm showing this fovea? Basically, nowadays some research is going on about the fovea. Most of the researchers says that the fovea works in case of alopecia X, and because no treatment is working in alopecia, like lot of treatments are going on, melatonin, then microneedling, and then deslorelin. So various researchers and various authors says like this is working, this is not working. So now fovea is quite famous, that it claims like there's a hair regrowth due to the fovea treatment. Basically, this is the photobiomodulation, low level light therapy, which increases the growth factor and collagen. It also promotes natural skin regeneration and help in the wound repair. And also it reduces the need and duration of systemic therapy. And it is useful also for surgical wounds, pyoderma, furunculosis, and perianal fistula. Applicable in dogs, cats, and horses. And then after age and breed, we will talk about the color. How on the basis of the color we can find out or detect some dermatological conditions. Do you know what kind of conditions you will see because of the color associated? Like this is the American short hair breed, American bully, and you will see the redness erythema on the groin area, particularly in short coated breed. Okay. So basically, this is actinic dermatosis, which is also known as the solar dermatosis. And on the basis of dermatopathology, what we see, this ground glass appearance of the collagen and hyalinization of the collagen, and you will see this blue color thread-like appearance, which indicate the solar elastosis. Okay, so for the confirmation, we can do dermatopathology for solar elastosis. So this is again, which breed is this? This is a Doberman, blue Doberman. And whenever we see the blue Doberman and alopecia is there, so what do you think? What comes to your mind first? This is basically what? Color dilution alopecia. So just on the basis of age, breed, then distribution and eyes or ear, we can like make a differential diagnosis without even doing any diagnostic test. Okay, so solar dermatosis is quite common in white coated breed, and distribution is like erythema or ulcer, while in case of color dilution alopecia, we see in case of the dilute or blue color or fawn color breed of like doberman, and sometimes in labrador and some Dachshund. So this is the genetic follicular defect, and especially you can see on the truncal area, alopecia and scaling is there in color dilution alopecia. Okay, now after age, breed, and coat color and sex, distribution of the lesions is quite important because there are few condition, skin problem, we can see symmetrical lesion. For example, in autoimmune and immune mediated condition, you will see the symmetry. But in case of the infectious, parasitic, fungal infection, you will not find any kind of symmetry. So when you draw the line from nasal to the tip of the tail, what you will see when there is a asymmetry, think of parasitic or infectious cause. But when there is a symmetry, think of endocrine, immune mediated or autoimmune diseases. Okay, just on the basis of distribution. And again, think of this presentation. Whenever you see the paw pad involvement, crusting, fissures, or hyperkeratosis, so this is not the common presentation. We always think of something else going on. Think of pemphigus, think of zinc responsive dermatosis, and think of superficial necrolytic dermatitis. So always rule out these diseases without doing, like, without wasting your time. Then again, the distribution, if we talk about the pinna, because there are few diseases which is typically present or typical or classic presentation when you see the tip of the pinna is involved. So think of sarcoptes. Okay, when you see these kind of lesions, then sometimes vasculitis. When you see whole pinna, medial pinna involvement is there, think of some kind of contact allergy due to drug reactions. Okay, so this is the various presentation. We can again make out our differential list just on the basis of distribution or pattern. For example, this is the pug. If you see the lesions like that, in particular lumbosacral area, all other parts of the body are completely normal. So the first thing what comes to our mind, flea allergy dermatitis in lumbosacral area, because this is the like common site for fleas. Now, this is again what you are seeing here. This is the Jack Russell Terrier, and here you can see the white hair is completely normal, but the black part of the hair is involved. So, what do you think? What it could be? Alopecia just confined only to the black haired area, and this is the hallmark of black hair follicular dysplasia. Okay, so without thinking anything, what you have to tell to the owner, like, this is the follicular dysplasia or genetic defect in your dog. So that's why the only black hair is involved, other hair is completely normal. So this is the typical presentation for the black hair follicular dysplasia. But if you want to do confirmatory diagnosis, send the sample for histopathology. You will find melanin clumping in the hair shaft with fracture, and also you will see the pigmentary incontinence around the anagen hair follicle. So this is again another example of follicular dysplasia, where you can see the melanin clump inside the hair or in the hair shaft. And then this is the typical presentation of other condition of dermatology, where you can see the bilateral symmetrical alopecia without the evidence of inflammation, no pruritus, no inflammation, just symmetrical alopecia. And also one more important feature, you can see the pot-bellied appearance. So what do you think? This is a typical classification of what? Cushing syndrome or hypercortisolism, where you can see the thin skin, visible vessels, bruising, decreased collagen and elastin, and increased telogen hair. And also, you will see the hyperpigmentation, which is the increased risk of infection, recurrent pyoderma in these patients. You will see, sometimes you will see the demodicosis in adult patient, or we call it adult onset demodicosis, particularly in hyperadrenocorticism patient. And also sometimes we will see the secondary fungal infection, and very commonly calcinosis cutis, or you will feel the like hard gritty feeling when you touch the animal. Okay, and sometimes you will see the demodicosis in Cushing patient and erythematous papule, which form the gritty plaque or ulceration or crust, just like in these pictures we can see very clearly the calcinosis cutis. And on histopathology, you will see the calcium very clearly. Like this is the dark color minerals you can see on histopathology in the dermis. So this is the classical feature of calcinosis cutis, particularly in Cushing dog, or sometimes you will see in iatrogenic Cushing too, when we give steroid like topical or injectable form. And sometimes you will see the transepidermal elimination of mineralized collagen in Cushing patient. Now, this is the another example of dermatology skin presentation where you can see the hyperpigmentation and particularly the rat tail appearance, or sometimes you will see the myxedema, facial myxedema, or tragic look appearance, which is the common finding in case of the hypothyroidism. And especially you will see the rat tail appearance. This is the classical feature of hypothyroidism when there is alopecia in the tail area, and also when you see the like alopecia in the nasal planum or dorsal muzzle alopecia. These are the two features which is very classic in case of the hypothyroidism patient. So, and also always think about the age, because I have already mentioned that middle to adult dog have thyroid problem, not middle, even the adult one, like more than 5 or 6 years, because sometimes I have seen so many reports when we do the sample of like thyroid profile under 1 year of age. So always make a differential diagnosis on the basis of the age, breed, distribution, and lesions presentation. And again, this is the next example where you can see this is Akita, where you can see the alopecia, patchy alopecia, crusting, dry, brittle hair coat. So this is the classic example of sebaceous adenitis. And how you identify sebaceous adenitis? Basically, in sebaceous adenitis, you will see the follicular cast, okay, and dry, crusty coat, and alopecia, and so this is the classical presentation, and which is quite common in Akita breed, and sometimes you will see in case of the poodle too. Okay, so don't confuse this presentation with dermatophytosis or any other scaling condition. Always rule out while doing that microscopic examination, hair pluck, or sometimes we need to send the sample for dermatopathology for just confirmation. Because on dermatopathology, what you will see absence of sebaceous gland, or if there is a presence of sebaceous atrophic sebaceous gland is there, but around the sebaceous gland you will see the infiltration of inflammatory cells. So this is the confirmatory diagnosis for sebaceous adenitis. And this is again another example, and this is very typical classical presentation whenever you see the depigmentation of the skin between the nasal planum and upper lip. So this is what comes to your mind when you see in older patient, and scaling is there, pruritus is there, lot of white scale is there throughout the coat, and depigmentation between the nasal plenum and upper lip. So basically, this is the classical presentation of epitheliotropic lymphoma. Okay, so whenever you see this kind of presentation, immediately like make your differential, top differential is epitheliotropic lymphoma, and go for it, go for the diagnosis, because it is quite dangerous disease and prognosis is quite poor. Then again, which breed is this? This is actually boxer. And whenever you see the cyclic like flank alopecia or hyperpigmentation, no pruritus, just alopecia on the flank area, what do you think what it is? What you call this condition in dermatology? So this is basically, as the name indicate, flank alopecia, cyclical flank alopecia. So this is quite common in case of the boxer, bulldog, sometimes you will see, but boxer is quite common presentation of cyclical flank alopecia. So yes, so we have learned about the presentation, distribution, age, breed, coat, color, sex. Then this is, what do you think what it is? This is the human hand, and this is the same like pet's hand, pet's elbow. When you see the same papular eruptions on the elbow and the human, what do you think? So there are only two diseases or few diseases which can transmit to the human, like dermatophytosis and scabies. So this is here when we did the microscopic examination, we found lot of eggs of Sarcoptes. So this is the basically Sarcoptes. Then after that, we need to like know about lesions. Primary lesion, what do you mean by primary and what do you mean by secondary? Why these lesions are important? But because when we study the primary or secondary lesions, we think it is quite easy. Macule, papule, vesicle, pustule node. Everybody we know about this pustule, vesicle. But what happened? Why it is necessary to understand? Because there are few disease dermatological problem with these like lesions presentation, because whenever you see the whole pustule, something else going on. When you see the yellow crust, some specific disease are related, for example pemphigus foliaceus. When you see the vesicle, then vesicular diseases are there. So we need to correlate with these lesions with the dermatological problem. And then some lesions are there, again, the primary lesions, which is more than 1 centimeter in diameter. For example, the patch, plaque, and wheal. So this is again the presentation of few dermats. So we need to learn about the lesions. And then secondary lesions are there. But what happened? Primary lesions is related to the disease. And what do you mean by the secondary lesions? What the animal did to the disease. Okay, so sometimes we fail to diagnose the dermatological problem on the basis of secondary lesions. But if there is a primary lesion, we can immediately diagnose, okay, this is the pemphigus, this is the pyoderma, this is the dermatophytosis. But on the basis of secondary lesions, sometimes we are not able to diagnose particular disease. So, like for example, epidermal cholerae. When epidermal cholerae like becomes after pustule, okay, so whenever you see the epidermal cholerae, we need to differentiate it with the dermatophytosis, because sometimes you see the circular epidermal cholerae on the skin, which looks very similar to the ringworm or dermatophyte. But when we do the tape strip examination on cytology, you will see lot of cocci. So sometimes it becomes difficult to diagnose just on the basis of secondary lesions. That's why we need to identify or diagnose very carefully when you see the secondary lesions. Excoriation, lichenification, erosions, or ulcer. And sometimes in fish, you see the fissures, fistula, and scars. And primary lesions also, like scale and crust is there, but there are lot of scales, like different type of scale presentations in different type of dermatological conditions. So we need to identify what kind of scale is present in what kind of skin problem. Okay, so I'll like show you a few examples. Like here is a different presentation of scale. Like here is different, generalized scaling is there. Here little bit crusting. Then here it is like a epidermal cholerae. Here it is a like dandruff-like appearance. And here it's like a little bit crusty, adherent scaling is there. So basically this is different presentations. Sometimes you will see the crusting on the nasal planum. Sometimes you will see the crusting on the abdomen. Sometimes you will see the epidermal cholerae. So how these pattern of scaling gives the important clues for the diagnosis in veterinary dermatology. Okay, so how? For example, if we see the hyperkeratosis, particular area like on the nasal planum or on the body, and there is a pruritus or erythema too, or some serpiginous lesions also sometimes you will see, then think of something else. It is not just like a dermatophytosis or not just an infectious cause, something else going on in older patient. So when you see these kind of presentation, there are few diseases, for example, erythema multiforme. In erythema multiforme, you will see the scaling. Also, you will see the serpiginous pattern of lesions, erythema. So always go for further diagnosis, not just the not like microscopic examination will not tell you about the perfect diagnosis. So we need to go ahead for diagnosing these kind of conditions. So for example, when you see these patients, depigmentation of the skin between the nasal planum and upper lip, and scaling is like this. And if we are treating these problem with the antifungal shampoo or antibacterial shampoo or with antifungal or antibiotic, it will not cure. Why? Because this is not a dermatophytosis, and this is not due to the dandruff, and this is not due to the parasitic or chiletiella or chiletiella mites. This is something else. This is a neoplasia. Okay, so we need to detect why these scaling is present in older patient with this presentation, like depigmentation of the skin between the upper lip and nasal planum. Okay. Like in case of this patient, you will see the crusting, yellow crust is there. So always think of, if you see the yellow crust or honey color crust, always think of PF, and you will definitely see on cytology the that acantholytic cells. And this is the very common presentation in India, especially in case of the cats. You will see the lot of crust on the face, or particularly on the face or the ear pinna or ear margin, or sometimes you will see the crusting on the paw pad. So always rule out. What do you think what it is? It is not PF, but if you do the superficial scraping, you will see the lot of mites. So this was the case of actually notohydrous mites. And here you will see the Pomeranian Spitz breed, where you can see the nasal plenum crusting. And when we did the cytology, we found lot of acantholytic cells. And then follicular cast. Also, to understand about the follicular cast is important, because sebaceous adenitis is related to follicular cast, but also the demodicosis cases, you will see the follicular cast. But the line of treatment is completely different for demodicosis as well as for the sebaceous adenitis. So always, whenever you see the follicular cast on microscopic examination, first we need to rule out demodicosis. Okay, then if you have ruled out demodicosis, then go for the diagnosis for sebaceous adenitis, because the presentation is quite similar, but on histopathology you will confirm whether it is a demodicosis or sebaceous adenitis. Okay. So this is the presentation. Like here, you can see the follicular cast on the margin of the ear, and as well as sometimes in case of the demodicosis, you will see the same presentation. Okay. Then we have studied about medical history, dermatological examination, and prioritizing problem list and differentiation. And we will now brief about some diagnostic test, because after knowing all those things, then diagnostic test is important too. Okay, but the study about like knowledge about dermatology, knowledge about dermatological diseases, breed, age, presentation, distribution is very important before doing diagnostic test. So for diagnostic test, we usually do the cytology, skin scraping, trichogram, fungal culture, biopsy in-house. And cytology is quite important, very important, in fact, in every case. And before that, the most important equipment in dermatology, do you know what? It's a brain. Because we should use our brain to just like think of which diagnostic test is important in which condition. Because sometimes simple young patient presented to us, and we know there's a focal alopecia on the face, that patient just need microscopic examination. In that patient, don't do CBC, biochemical analysis, thyroid profile. No need to go for that. Just the microscopic examination will give us the right diagnosis. Okay. And then if the middle-aged patient comes to you with alopecia, with redness on the paws, groin, on the groin area, on the facial area, then always think of to rule out all the infectious causes, do the food trial, and after doing those stuff, then come to the point for the diagnosis of atopic dermatitis. If you ruled out everything and the patient is middle age or older, then think of neoplasia. So this is the way we have to approach any diseases. Okay, young patient, just microscopy or cytology. Middle age patient, then go for another thing. Or older patient, then go for the ultrasound or other modalities, or thyroid profile or ACTH stimulation test or whatever. Then cytology is quite valuable tool. It gives us immediate results, and then low cost to the hospital, and it will give us to differentiate between malassezia or bacterial infection, or it tells us about the type of inflammation differentiated with the neoplasia. So on in-house basis, like in-house, we can detect what kind of inflammation it is, and also monitor response to the therapy. And basically for cytology or skin scraping, we need cotton tip applicators, needle, transparent acetate tape, toothpick, red rubber catheter, and culturate. And depending upon the location or the type of lesions, we use these things for the collection. Like for example, in ear we use the Q-tip, then in skin fold interdigital spaces sometimes we use the tape strip, and claw fold we use that toothpick, and trunk and limb. So on the basis of the location we choose ourselves what we need to use. Like sometimes we use the direct impression slide. For example, in this patient, this is the moist lesion, so we can use the direct impression smear. And then how to obtain the cytology, everybody knows how to do with the direct smear. And for ear cytology, we always use the ear bud, and sometimes we write down L, or L stands for left ear and R stands for the right ear on the same slide. We can save the slide by doing this. And this is again, I'm showing you the non-healing wound in case of the cat. And what do you think when there is a non-healing wound in cat? What kind of problem this cat is suffering from? What do you think? What comes to your mind? Basically, this cat is suffering from the nocardia infection. So we need to collect the sample and do for the bacterial culture and sensitivity testing. So these kind of lesions, whenever there is non-healing wound is there, so always send the sample for the bacterial culture and sensitivity, so that we can detect what kind of acid fast bacteria, sometimes nocardia, mycobacteria, actinomyces bacteria are there for causing that non-healing wound in case of cats. Then for pustule, we need to break the pustule with the help of the needle, then make the smear with the help of slide. When there is a dry or scaly skin, always use some, I always use that tape strip, but you can use also the microscopic slide and wet the sample and collect the sample from the skin. Okay, and but transparent acetate tape is working well in these kind of lesions. Then in a skin fold or interdigital spaces, you can use the cotton tape applicator, and all, and also you can use the tape preparation. And then claw fold, we use cotton tape applicator or toothpick or sometimes tip, so that we can easily find out the malassezia. Sometimes there is no redness, nothing else, but the animal used to lick their paws. So always detect with the help of the toothpick and make it the like stain it, then you will get lot of malassezia on the slide under microscope. So this is the diff quick stain. First one is the methanol, and the second one is the red stain and the blue stain we are using. And these stain we need to change weekly if you have a like more practice or good practice in your clinic. So always change these solutions in a week basis. Then skin scraping, we all know how to do it. Scrape it with the help of the mineral oil, and you can see demodicosis, or sometimes you can see on crusty cat patient, you will see the lot of notodrus mites, which is quite common when you do the superficial scraping. And in our clinic, these things are very important. We all should have this thing in our like dermatology box: scalpel blade, microscopic glass slide, cover slip, then paraffin oil or acetate tape, flea comb, forceps, Q-tips, diff quick staining, syringes, needles, wood slam, and sometimes you can keep DTM agar for fungal culture. And then biopsy instruments is very important in some diseases, which I have shown you already, that we need to send the sample for dermatopathology or histopathology. And how to look for the parasite, because most of the time what I have seen that even I don't know initially how to do how to see the parasite on microscope, under the microscope. What we have to do, we need to decrease the density of the light of the microscope. Okay, so iris and condenser plays very important role in the microscope. So always decrease the density of the light when you want to see the demodex or sarcoptes under the microscope, correct? But yeah, so diagnosis of the ectoparasite, sometimes we use the flea comb when there's a flea, and for microscopic examination, combed out the material, skin scraping, hair pluck, acetate tape preparation. So these are the 4 techniques we can detect the parasite, various kind of parasite on which causes skin problem in case of the cats and dogs. Then indication for superficial scraping. Whenever you see the papule crust or pruritus, think of sarcoptes and notodrus. And when you see the erythema and pruritus, demodex cornea, particularly in case of the cat, then scale and pruritus, sometimes scaling is there, then think of Clitella. When you see the orange crust or pruritus, then think of chigger mites. Pruritic otitis is there, especially in case of the young cats. Otodactys mites is the common culprit. Then cat-specific reaction pattern. Then in cats, you always think of Otodactylus, Chiletiella, lice, Sarcoptes, Notohydrus, Demodex gatoi. And when there is a pruritic skin lesions in contact human, then think of some parasite which causes zoonotic infection, for example, Sarcoptes, Notohydrus, and Chiletiella. So these are the presentation of the Sarcoptes which I saw in my clinic. And then on cytology sample in dermatology, especially, there are three things are important, like to identify organism. That is cocci, rods, and malassezia. That's it. And few inflammatory cells like neutrophils and eosinophil. Just on the basis of these organisms, we can make like a good differential, whether it is a bacterial or malassezia or inflammatory condition, just on the basis of the cytology, we can interpret. Okay, like for example, whenever you see this footprint appearance or this snowman appearance of the like this organism on the under the microscope, basically this is what this is, malassezia. So this is the fungal infection. So we can treat accordingly the patient. Okay, classic footprint or peanut shape appearance. So normal. Whenever you see the one or two yeast in the section of the slide, this is completely normal. But what happened when you see the more than 5 yeast per oil immersion field, that is abnormal. Okay, and one yeast. But if you see one yeast with under oil immersion field with inflammation, okay, along with the neutrophil, that is again, it is abnormal. And then if we talk about the bacteria, when you see the cocci and rod, sometimes you see both. So it indicates infection or overgrowth. So what is the difference between the infection and overgrowth? Basically, when you see only the bacteria, no neutrophils, that is bacterial overgrowth. And when you see the cocci along with the neutrophils, that means there is an infection. Okay. So in that way, we can differentiate or treat the condition as per the requirement. Then always show your client whatever you see on monitor, like ear mites or otodactylus mites, especially in young Shih Tzu or along with the cats. You will find very commonly in case of the cats and young Shih Tzu, the otodactylus mites. And always check like specific areas around the muzzle, like nasal planum and perianal area. Don't leave this otherwise, because this is the common area for mucocutaneous problems. Sometimes autoimmune diseases are related to these specific areas. So we need to check always these particular area. And this is, I am showing you a very good cutting edge like technique so that we can kill the MRSA, like methicillin resistant staph pseudo intermediate bacteria with the help of CAMP. Basically, this is a cold atmospheric plasma, which is quite helpful in MRSA. Then we also check inflammatory cells under the microscope, like neutrophils, histiocytes, eosinophil, and mast cell. And some epithelial cells also give us the diagnosis, for example, the zinc responsive dermatosis and some parakeratotic condition when we see the nucleated keratinocytes under the microscope. And then this is inflammatory cells. We all know when you see the macrophages along with the neutrophil, we call it pyogranulomatous lesion. When you see the neutrophil, neutrophilic inflammation. When you see the eosinophil, eosinophilic inflammation. This is the common finding we see just under the microscope doing cytology. And then you see the corneocytes, sometimes keratinocytes and acantholytic cells. And epidermal differentiation, why it is important. Whenever you see the stratum corneum, like corneocyte, you can like feel like, yeah, it's just a superficial infection because we see only the stratum, that corneocyte. But whenever you see the nuclei in the corneocyte, keratinocytes, always think something deeper going on. Okay. Whenever you see the neutrophil along with the acantholytic cells, that means stratum spinosum is involved. So just on the basis of your examination, cytological examination, we can detect which layer is involved. Okay. So this is all about. Then trichogram, we all are doing in our clinical practice. Hair pluck for the identification of some parasites, certain diseases which we have already done, like black hair follicle dysplasia, color dilution alopecia. And also sometimes this is the best screening test for dermatophytosis. We can detect fungal spores just on the basis of hair pluck. And also this is the screening test for endocrinopathies. You can see the telogen arrest on hair pluck. And trichogram, basically, it is quite helpful in self-induced alopecia and color dilution alopecia in dermatophyte. And this is quite like very, very like easy method. 1 drop of mineral oil you required and few hairs and align in the same direction, put the cover slip, and then see under the microscope. Okay, so it require practice just. And then this is the again trichogram. Here you can see the clumping of melanin, and this the another the right image showing the broken hair. And this is the dermatophyte you can see on hair plug, and sometimes few veterinarians are using dye or stain to look very clearly the hairs that's dermatophyte exposed. And then sometimes we use sometimes most of the time we use the fungal that wood slam for the identification of microsporum canis fungus, which is the quite common fungus where we can detect more than 50% of the stains fluorescence, particularly the microsporum canis under the wood slam. And when the client comes with these lesions, always think of microsporum or fungal infection in their pet. So always do whatever you want to do, like wood slam. Under the wood slam, you can detect the fungus, microsporum canis especially, and also you can see under the microscope. So lot of spores you can see on microscopic examination. And then this is the wood slam where you can see the green apple green fluorescence under the wood slam. So this is the classic presentation of microsporum canis especially, and only the microsporum canis is the fungus you can see under the wood slam examination. No other fungus you can detect under wood slam. So for other fungal examination we need to send the sample for fungal culture, and sometimes we need to send for confirmatory, we can send for dermatopathology, because most of the time in my cases I fail to detect fungus on like fungal culture, but we detect fungus from dermatopathology or histopathology. So these are the quite common presentation for fungal infection. And yeah, and you can see the ectothrix spores of microsporum canis surrounding the hair shaft here. This is very clear, mounted in 10% potassium hydroxide. Okay, so this is the quite common presentation. Sometimes focal alopecia is there, and sometimes scaly lesions are there. And nowadays, very commonly, I have seen the carrion or pseudomycetoma cases, particularly in case of the cats. And I have seen few cases of carrion in case of the dog also. And I have presented this paper in few conferences also regarding carrion. Okay, and for asymptomatic carrier without lesions, we can do the Mackenzie brush technique. Like this is the Mackenzie brush technique, where this is the way we can collect the sample and send the sample for culture, and you can find out what kind of fungus affecting particular patient. Okay, now the PCR for ringworm, basically PCR detection of dermatophyte DNA helpful. But what happened, why I'm not a big fan of PCR, because PCR does not necessarily indicate active infection. Okay, only that fungal DNA is present. These PCR also detect the dead fungal organism. That's why it is not like gold is standard for the detection of ringworm. Although the fungal culture is quite the good way to detect the ringworm infection above all. Then last is the biopsy. So biopsy is very important thing to detect dermatological problem, and this is very again easy. Rotate in one direction. Don't shrivel it. Then send the sample for the diagnosis. Okay, and most common biopsy we are using like 6 to 8 but if the lesions is present on the face, then you can use the smaller one like 4 near eye pin or nasal planum, or sometimes on foot pad, or in small dogs or cats. And always whenever present the crust is present on the face or anywhere, don't scrub it, because we need to include the crust, because on the crust only we can find out the acantholytic cells. So this is the tips and tricks of doing biopsy. And whenever you see the ulcer on the body, so don't take the sample from the center of an ulcer or necrotic area, go for the margin, especially on the ulcerated area. And this is very important slide, that is drug washout period before diagnostic test. So whenever you want to do diagnostic test, always remember these things. Like cytology washout period, shampoo washout period is 1 week if you want to do the cytology, because shampoo also, the topical application also can mask the disease condition. And if you want to do the biopsy, then 2 weeks. Glucocorticoid also, it will not affect the cytology, but it will affect your biopsy. Then injectable steroid, 5 weeks. Okay. Cytology, washout period, and then 6 weeks in case of biopsy. And this is the way we need to remember. Although cyclosporin will not affect the cytology, but we need to remember, if we want to do the biopsy, at least 1 week washout period for cyclosporin. Okay. And also NSAID, it will not affect your cytology, but if you want to do the biopsy, stop NSAID for at least 1 week, then do the biopsy. And biopsy medical report, this is again very important thing, because if we want to send the sample for biopsy, we always need to provide thorough history, including signalement. Always describe the lesions, whatever I have mentioned, like primary lesions or secondary lesions. Always mention it. Then make your top differential. Like, what do you think what it is? So your dermatopathologist make your it is easy for your dermatopathologist, and always include pictures. Okay. So, just one case I am showing you, like it's a golden retriever. And whenever you see the hypotrichosis or alopecia, particularly on the caudal dorsum or flank area with no pruritus, what do you think what it is? So, this is basically, it looks like what is your differential diagnosis? Whenever you see the golden retriever, we think of thyroid, we think of Cushing, because it's a non-pruritic alopecia. But in this case, thyroid was normal, and LDDST was normal. But we sent the sample for histopathology. Then we got this. This is what? This is the witch's foot appearance, which is quite commonly we see in case of the cyclical flank alopecia. So this was the case of cyclical flank alopecia, where we see witch's foot appearance of the hair follicle, follicular hyperkeratosis with the atrophied hair follicle. Okay, so this is the seasonal flank alopecia, which is quite common. And this is very common presentation. You can tell anyway, whenever you see the pot-bellied appearance, bilateral alopecia, and you will see on dermatopathology atrophy of the epidermis, atrophy of the dermis, and even the atrophy of the sebaceous gland and follicular atrophy. So this is Cushing. Third is, whenever you see the dermal nodule, multifocal raised dermal nodule, and whenever you send the sample for dermatopathology, this is not the common fungus. This is uncommon fungus, where you can see the pigmented fungal hyphae with pyogranulomatous inflammation. So this is the classical finding of pheohyphomycosis. This is the uncommon fungus. Okay. So this is the last quiz from my side. What is your diagnosis when you see these kind of dermatopathology in the hair follicle? You send the answer in the answer box or chat box. Okay, thank you everyone. And my take home message is, structured clinical approach is the key to accurate diagnosis. Careful history taking and lesion recognitions are the foundation of dermatological diagnosis. Age, breed, coat color, sex, and lesion distribution provides major diagnostic clues. First narrow the differential, then confirm the diagnosis logically. A logical diagnostic pathway saves time, improve accuracy, and avoid unnecessary treatment. Observe carefully, think logically, and investigate systematically. The skin speaks. Clinician must learn how to read it. A disciplined diagnostic approach leads to confident diagnosis, targeted therapy, and better patient outcomes. Thank you everyone. Always remember, diagnosis is not the end, but the beginning of patient care. And on behalf of IAVD, I would like to welcome you all for
Dermatology conference. Welcome to the 4th to 6th June.
In ITC Royal Bengal, Kolkata. Looking forward to see you all. Thank you very much. Thank you, everyone. And I'm very happy to take if you have any question.
Thank you, Dr. Anisha, for that insightful and detailed practical session. And it's time for interactive Q&A session. If you have any questions for Dr. Anisha or the IAVD team, please drop them in the chat box. We will take one by one. We already have some questions. We'll start taking. So from Dr. Bish Nisar, he's asking how often the use of antibiotics justified for metabolic or any other systemic diseases in case of topical lesions are present. Also brief about the topical versus systemic medication in case of infectious or fungal dermatitis. As in daily practice, we see excessive use of oral antibiotics and fungal antifungals for mixed dermatological infections.
See, first of all, I will give you a first answer about the metabolic diseases. First of all, we need to diagnose the metabolic diseases because metabolic diseases sometimes you will not see any kind of secondary bacterial or fungal infection. So, first thing, what we have to do, go for ultrasound. If you think of, like, for example, SND, superficial necrolytic dermatitis, it you will see the lot of crusting and lot of sometimes erythema, but when you do the cytology you will not get anything, correct? So without seeing cocci or without seeing rods, you need not to go for antibiotic. First of all, for that we need to do what? Ultrasound, then skin biopsy, you will see the French flag, then go for amino acid infusion, which is the correct way to treat SND. But if you see the superficial, the second question is about the superficial or deep infection, right? Dr. Srijana, am I correct?
Yes.
Huh. The second question is about superficial infection or deep infection?
Yeah. It was about topical versus systemic medication
Yeah.
in case of infectious or fungal dermatitis.
Exactly. So there is a very good guideline present in you can see the in the Google where Koji Nishifuji also last time presented in our conferences regarding the superficial surface or deep infection. So whenever you see the surface pyoderma or surface infectious agent, always try to use the topical therapy. Don't use the systemic antibiotics in that conditions. Or whenever you see like the deep infections, always try to do the cytology. So just on the basis of the cytology, you can detect what kind of bacterial like cocci is present or rods is present. Along with the rods and cocci, there's a inflammatory like neutrophils, eosinophils. So what is the presence under the cytology? Just on the basis of your diagnostic, you can initiate your line of treatment, correct? So surface versus superficial versus deep. So just on the basis of your cytological finding, you can treat your disease condition accordingly. But try to use topical therapy as much as for your superficial infection. And we talk about the fungal infection as well. So there are lot of topical therapy for fungal infection. For example, miconazole, ketoconazole, terbinafine. Uh, I'm talking about the surface like topical therapy. So you can use topical antifungal agents for your like superficial infection. But for example, if we talk about the carrion, if we talk about the pseudomycetoma, then you need sometime systemic antifungal therapy along with topical antifungal therapy because it is quite deeper. So just on the basis of distribution, presentation, and your cytological finding, you can initiate your line of treatment.
All right. So next question is also brief use of cytopoint in atopic cases.
Exactly. So atopic dermatitis, if we talk about atopic dermatitis, there is a quite multimodal approach because still we don't know which interleukin is involved in which case. Okay. Like what cytopoint is actually, what is cytopoint? It is a monoclonal antibody which acts against interleukin 31, which is the main causative agent of itch. Okay. But sometimes what we see, cytopoint is not working, but oclacitinib is working, steroid is working, some anti-allergic is working. So it depends on case to case. And sometimes we have seen there are few cases cytopoints work so well. And the benefit of cytopoint is that we can use cytopoint in younger patient, but oclacitinib or any other immunosuppressive drugs we cannot use under 1 year of age. But there are few companies coming up with the that ilunocitinib and some atinocitinib, we call it Numelvi. They claim that we can use Numelvi under 1 year of age or 6-month-old patients. So still research is going on, like which drugs work against which interleukin, because interleukin 4, 6, 13, 31, there are a lot of cytokines are there. which causes itch. But the main itch signal caused by what? Interleukin 31. So yeah, so it depends actually from breed to breed or species to species. So I cannot tell much about the cytopoint, but yeah, cytopoint is quite good in younger patient for
Okay,
just
doctor.
maintenance of the itch.
So next question we will take. Can 3 months retriever puppy have food allergy?
Yeah, basically it depends. Or again, it depends because most of the time I have seen in younger patient the food intolerance, rather food allergy. So we need to check what causes intolerance in such a young puppy. Sometimes milk causes intolerance, and sometimes because small puppy are quite lactose intolerant. So we need to check whether really it's a food allergy or something else in such a young puppy.
So Dr. Bhavani is asking what treatment protocol can we follow if there is external parasitic infestation in young animals less than 50 days and less than 2 kgs weight?
Yeah, for younger patient, you can use lime sulfur is quite safer if we talk about like less than 2 kg or 5 kg body weight puppies. So you can mob the cotton balls with the lime sulfur on particular area where it affects. So with the time fit, then you can use the spot on, various good spot on are there. So yeah, after 45 or 50 days, you can use it. Till then you can use the lime sulfur because it acts as a antiparasitic, antifungal as well as antibacterial.
Okay. So Dr. Naveen is asking what is correct way of using shampoo? How we can differentiate? Okay, so first we will take what is the correct way of using shampoo.
Okay, so this is again depends upon the condition. Although we recommend in, because I live in Jammu and Kashmir, so what we recommend and what guidelines says, like once in a week we can use shampoo, and the contact time should be 3 to 4 minutes. And it also depends upon what kind of condition is there. If there is a bacteria, you need to use the antibacterial shampoo containing chlorhexidine or antifungal miconazole. Okay, and if there is a skin dryness or scaling is there, then antiseboric shampoo you can use. And but the contact time should be 3 to 4 minutes. And also the frequency depends, like most of the time we have seen the fungal infection cases, then you can increase the frequency twice in a week with the topical therapy, like topical spray along with the shampooing, because most of the client is not uh, able to do the shampooing therapy or client compliance is there. So according to client condition or according to the condition of the dog, we can use shampoo. But the correct way of using shampoo is once in 10 days minimum, and once in a week minimum, and once in 10 days, and 3 to 4 minutes the contact time.
Alright. So next we will take how we can differentiate atopic dermatitis from other similar dermatitic conditions.
Exactly. So, atopic dermatitis, we call it the seasonal. Okay, so it is based on the seasonality. But if you see the same lesions presentation on the paws, groin area, or facial or ear involvement, always rule out food allergy first. Okay, by giving the hypoallergenic diet or novel protein diet. And what we call hypoallergenic diet, basically where the molecular weight of the protein should be less than 10 kilovolt or Dalton. So you need to rule out first the food allergy and also the flea allergy, and always educate the client about the long-term therapy, particularly in case of the atopic dermatitis, food allergy, and flea allergy dermatitis, because all these three kind of allergy looks quite similar. So we need to rule out step by step, like bacterial or infectious causes first, then food allergy, then ultimately the atopic dermatitis.
Alright. So there is a question from a second year student asking for study tips for pathology, microbiology to study diseases in perfect manner.
So you need to practice. You do, like you can have one microscope in your room and always try to do the basic things, the normal anatomy and abnormal, like always try to do the cytology and study about, like you need to practice a lot. That's it.
Yes. And next we will take question from Dr. Naveen. In small culture Pomerian less than 3 kgs weight, what can be used in lice infestation?
Yeah, exactly. I have already mentioned like lime sulfur is quite
Yeah, this was
Good.
taken earlier also, yes.
Yeah. So you
Next,
can.
Dr. Akhil is asking when to use 10% potassium hydroxide in microscopy.
So whenever you want to see like spores, dermatophyte spores, so I usually use the 10% potassium hydroxide, and especially during the hair pluck examination.
All right. Thank you so much, Dr. Anisha, for patiently answering all those questions and for such an insightful session. And with this, we now invite Dr. Nilesh to deliver the vote of thanks. Over to Dr. Nilesh.
Thank you.
Very good evening to all of you. Thank you, Dr. Anisha. You have been always the best speaker, and being a practitioner, you discussed very good practical things. And I'm happy to see that some students are also interested in asking questions. And your whole presentation was linked to practical aspects. That was a wonderful thing. Thank you. Thank you, Nagarajan sir, for again organizing such a nice webinar for all practitioners as well as students. And thank you, Drools, who had been a wonderful partner of IAVD. And we will look forward to meet you all in ITC Royal Bengal from 4th to 6th June 2026. It's coming near. Book your tickets. Come to Kolkata. We will meet at Kolkata. Thank you. Thanks a lot. Good
Thank
evening.
you. Thank you, Dr. Nilesh. Thank you, Dr. Anisha and the IAVD team. And thank you all the participants again for joining us today for today's session. And we look forward to seeing you at our future sessions as well. So good day, everyone.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
Or fillers.
All natural, all healthy ingredients.
It gives them the best of both taste and nutrition.
rules.
Drools.
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 Drools. Feed real.
Fitly.